Cerebellar lesions and postural control. Postural control is impaired to varying degrees, both qualitatively and quantitatively, depending on the specific cerebellar regions affected by lesions. Although lateral hemisphere lesions can cause severe upper limb ataxia, their impact on posture is minimal. In contrast, vestibulocerebellar lesions disrupt body orientation relative to the vertical axis, often leading to a slow drift away from upright posture. Notably, body sway is selectively associated with vermian, but not lateral, cerebellar volume. In cases of diffuse damage to both the cerebellum and brainstem, such as in spinocerebellar ataxia type 1, balance is broadly impaired, with greater instability in the anterior-posterior direction than in the medial-lateral direction. Ataxia may result from an excessive gain in intersegmental postural reflexes due to the loss of inhibitory control from Purkinje cell outputs. Additionally, postural responses in cerebellar ataxia fail to scale with perturbation velocity and remain consistently exaggerated compared to those of healthy individuals. While abnormal body sway may not be evident when patients have their eyes open, closing their eyes or perturbing posture, e.g., via platform rotation, can elicit pathological sway. Posturokinetic coordination is known to be disrupted in cerebellar disorders. The cerebellum appears to regulate both the timing and amplitude of motor activity. For instance, when cerebellar patients perform rapid arm movements while standing, their anticipatory postural adjustments, APAs, are abnormal, often exhibiting hypermetric muscle activity with excessive amplitude. Similarly, during tasks like rising on tiptoes, multiple aspects of the motor sequence are impaired, indicating the cerebellum's role in modulating the amplitude, duration, and temporal coordination of both anticipatory and focal movements. Feed-forward motor control is impaired in these patients not only during voluntary movements but also in response to predictable postural perturbations. Unlike healthy individuals, cerebellar patients do not adjust postural responses based on perturbation magnitude. Overall, their coordination deficits may stem from an inability to anticipate the muscle activations required to compensate for body dynamics.